Hi, my name is Anna Hardin, and today we'll be talking about an integrative review. The health problem for review are patients with chronic liver failure that live in rural populations, how the use of teach-back discharge educational practice compares to non-teach-back discharge educational practice affect readmission rates. People who live with chronic illnesses and those living in rural populations have a higher risk of preventable hospital readmissions. Patient education can have a significant impact on quality care and patient safety and leads to improved patient satisfaction. One evidence-based method of patient education is the teach-back method. Teach-back is a proven method to confirm when the healthcare professional has explained the necessary information in a manner patients can understand. 5 studies were examined during this integrative literature review. The focus of the literature review was to gain knowledge related to the use of teach-back method on knowledge retention and health literacy. Negarande, Mahmoudi, Noktidan, Hishmet, and Shakabazadi in 2012 in a randomized controls trial revealed with a power of 0.001 a significant difference with knowledge, medication, and diet adherence in diabetic patients who received teach-back versus traditional educational methods. White, Garbez, Carroll, Brinker, and Howie Esquivel conducted a prospective cohort study in which patients correctly answered questions of self-care after the teach-back method was applied 84.4% of the time during hospitalization. The authors also found that greater teaching time was associated with correctly answered questions with a power of 0.001. There was no significant reduction in 30-day readmissions with a power of 0.775. Kornberger, Gibson, Sadowski, Maleta, and Klingbeil in 2013 examined quantitative and qualitative data for nurses who used teach-back. The study found that nurses reported understanding of health literacy in teach-back with scores increased from 62 to 92% in literacy and 63 to 100 in teach-back fluency. The use of teach-back increased from 3.4% of the staff to 45.1% of the staff, and 98% of the nurses agreed teach-back was helpful. Qualitative data included quotes of correct questions to facilitate a discussion with patients, and nurses described the process as useful, valuable, simple, and great. Jagger and Wynia used a multivariate model to examine who was currently receiving education via the teach-back method. They found that patients who were statistically significant rate of receiving teach-back were those who were African American or Hispanic, spoke Spanish, had fewer years of formal education, and were 65 years and older. One interesting fact is patients who reported always having enough time with their physician had nearly 3 times the greater odds of receiving teach-back. These results showed 2 things. First, using teach-back might not only improve patient understanding, but might positively influence patients' perceptions on having time with their practitioner, and second, it raises concerns that some people who could benefit from teach-back are not receiving it. The most common demographic with low health literacy are white native English-speaking people. Wilson, Mayetta Pert, Prada Webster, and Nordstrom in 2012 wanted to know if teach-back was effective among all literacy levels. The authors found a moderately positive correlation between literacy and comprehension with a power of 0.05. The lower literacy levels gave a higher percentage of incorrect answers than those with a higher literacy level. Improvements for nursing practice would be an implementation of an evidence-based approach to patient education, the teach-back. Evidence-based practice drives everything nurses do, from hand washing to central line care. Having an evidence-based approach to patient education is essential to provide the safest care possible. Nurses need to empower patients with the medical knowledge to care for themselves at home. This knowledge also needs to be clear and be retained by the patient in order for patients to be able to be compliant. With this knowledge, the patient can be more independent with their medical decisions and be an active part of their care. The teach-back method could easily be incorporated into any nursing orientation. It's an evidence-based approach. It lets the nurse verify understanding and retention of the information given to the patient. It's simple, it's low cost. Once the nurse takes a class on teach-back, the skill would be incorporated into their evaluation competency checkoff. They would work with their preceptor to demonstrate and be evaluated on their teaching ability. And this could be accomplished in any inpatient setting. Thank you for your time.